Good morning, everyone. I have a preliminary announcement to make. An advisory from the Massachusetts Department of Public Health has been issued for all non-vaccinated and fully vaccinated people to wear a mask in public indoor settings in areas of substantial or high transmission. Shrewsbury, Worcester County, has been categorized as a high level of community transmission for over a month. Therefore, we require that all employees and visitors in all municipal buildings wear a face mask. Exemptions from the mask requirement include those with a medical or other eligible condition. In addition, we ask all those attending the meeting to practice social distancing, leaving space between yourself and other non-related parties also attending the meeting. The board members here this morning will also be masked and practicing social distancing through their seating arrangements. When speaking, we do ask that your face mask remain on. Thank you. This meeting of the Board of Health is being held on Friday, November 19th, 2021 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Office Building, located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. So I'd like to call the meeting to order. And the first item on the agenda is the review and approval of the minutes from the October 22nd, 2021 Board of Health meeting. Do I have a motion to approve?
So moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The meeting minutes are approved. The next item is to review and act on incorporating a soil test / perk test cancellation fee of $400 per lot into the Board of Health fee schedule in the event that an inspection is canceled and not rescheduled less than 72 hours prior to the scheduled inspection time and date. We're going to add language to the soil test perk application to indicate that all application fees are non-refundable and non-transferable. So, Julie, this is something that you were interested in pursuing?
Yes, I am. I'm interested in pursuing for people that cancel last minute, don't show up, the day of. It takes a lot of time, to go ahead and schedule soil testing for these engineers. And when people cancel last minute, they're taking away from others getting, their work done, as well as with my schedule as well. It takes up a big chunk of time. So to keep everybody on their toes, I'd like to incorporate that onto the applications. It is in other communities, but in Shrewsbury it is not.
Okay, thank you, Julie. That sounds like a reasonable request to me. Any questions, Dr. Abraham?
No, I agree.
Okay, in that case, do I have a motion to approve the addition of the cancellation fee to the Shrewsbury Board of Health fee schedule?
So moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The motion is approved. Thank you, Julie.
Do we need to do an effective date for that?
I suppose.
Yes, I believe so.
Because we have to update the Board of Health fee schedule.
Okay, what seems like a reasonable amount of time, Carrie?
You want to do December 1st?
If you could do December 1st, yeah, that'd be fine.
Okay.
So just to make it official, do I have a motion to approve the
Cancellation fee effective December 1st. Effective December 1st.
Yeah.
Yes, Mr. Chair, moved.
I second. All in favor signify by saying aye. Dr. Abraham?
Aye.
Myself, aye. The motion is approved. The next item is to review and discuss coronavirus COVID-19 update. Karen?
Sure. Good morning, Mr. Chairman. Good morning, Dr. Abraham, and my colleagues. So I just wanted to touch upon a couple of things. This week, actually yesterday, Governor Baker had a press release that came out that all Massachusetts adults ages 18 and older are now eligible to receive COVID-19 booster shots, provided that enough time has passed since their initial vaccine dose. And obviously, along with Governor Baker and Mass CPH and certainly local health officials, were encouraging COVID-19 boosters for all fully vaccinated individuals 18 plus. So on the state's website, there's a Vax Finder site, which does provide a list of booster locations. And that we also know not everybody can access or navigate technology, so people could call actually 211 to get assistance. We have been doing booster shots for the town employees. Amelia and Pat and others have come out to do that. We've been working with Kristen Loss and with Seth Colby to make that happen. We also are working with Superintendent Sawyer and Noel Freeman at the school to do some vaccinations for the kids. And I believe St. John's is also interested, so Amelia is working to set all of that up. We're going to continue to have a regular vaccination clinic for COVID shots for the employees as well. But again, you know, it's not like it was at the beginning of the year where it was difficult to find vaccine. It's certainly widely available. And just some other points about COVID. I believe yesterday was the highest amount of positive cases in Massachusetts since February of 2021. This isn't actually a shock to us. We've been talking about this for quite some time about what would happen once the colder weather came and people were going indoors and windows were being closed. So I think it just speaks to the importance of the board being proactive with having a mask mandate. The city of Worcester also has that, and so doesn't the town of West Boylston, all of whom are part of the Alliance. And I know there's a lot more other communities in Massachusetts that also have a mask mandate. So, you know, we have received emails and calls from some folks who have expressed their frustration about wearing masks, but we know they work. And, you know, when people say, well, then why are the numbers going up? There's still a lot of folks that need to be vaccinated. And, you know, there's still hesitancy out there, especially in communities of color, which is something that we've been working on here in Worcester constantly to work on acceptance of the vaccine. But also, we also know we have the Delta variant and we have Delta Plus and all these other, you know, mutated COVID strains that are coming up behind all of the things that we're trying to do. So we understand, you know, that people are frustrated. We are too. This is going on 2 years of working on this, but we have to be vigilant. We have to continue to do our best and do our part to try to mitigate this virus. And I think, you know, what Dr. Hirsch, our medical director, said weeks ago still stands true. I think we really need to see what the numbers look like 2 weeks out from Thanksgiving. You know, we're already seeing a spike. Worcester had, I think, 100 cases yesterday. I think Shrewsbury had 15. So we're seeing this go up, certainly over the last week and a half. So we're going to continue to monitor and just really encourage people who aren't vaccinated to get a vaccine, and also to folks to get a booster if they're eligible to do so.
Okay, thank you very much, Karen. Any comments or questions, Dr. Abraham? Or?
No, I think Karen is spot on in terms of the fact that we're seeing a surge because of vaccine breakthrough. We're at about the 6-month mark. There's a robust body of science which supports the need for a third dose or a booster. So I think it's just delay of people not getting enough boosters in. So couldn't agree more with her that we just need to get people sensitized to. And I'm glad the governor has moved for everyone to get it, because that's important. Otherwise, the age group that actually is transmitting infection is the younger age group. All the seniors are well immunized. So I concur completely.
Okay, thank you very much. Okay, we'll move on to the next agenda item, is to review and act on the report from the Central Massachusetts Regional Public Health Alliance. Micah, do you have
Sure.
items to report?
Just to add on to the mask mandate, it seemed to as mask wearing overall seems to have improved a lot. We've got a lot less complaints, and just businesses that I go into, I notice most businesses have a really high rate of people complying and wearing the masks. So I think it's definitely being more well accepted, and people are doing a better job. So other than that, we did a total of 63 inspections this month, and restaurants are still struggling with supply chain issues, staffing issues, things like that, but everything else is going well.
So nothing really of note to report on, pretty much routine.
Pretty much, yep.
Okay. Very good. Thank you, Micah. Okay, in that case, our next item on the agenda is to review the meeting schedule for our next meeting. Looks like
December 17th an option?
December 17th looks like a good date, get it in before Christmas.
Exactly.
So that would be fine with me, and if you could check with Jenny.
I just sent her a text, yep.
Okay. So let's make it December 17th at 8 a.m. then.
Okay.
Great.
Okay. In that case, do I have a motion to adjourn?
So moved.
I second. This meeting is now adjourned. Thank you, everyone, for coming.
Thank you.
Happy Thanksgiving.
Happy Thanksgiving.
Yes, thank
You too. Thank you.
Enjoy. Take care.